Today, we're joined here with several of our trainees who have joined us over the course of the year of 2024, in addition to our portfolio manager, Julie Linhart, who helps to manage this program. Today, you'll hear a little bit more about the trainees themselves, their interest, how they found out about the Innovation Lab, their exciting work, and advice that they have for you if you're interested in working with us. With that, I'd like to introduce them to you all. We'll start with Julie Linhart, our portfolio manager.
Hi, I'm Julie Linhart. Like Ali said, a portfolio manager with the Innovation Lab for the last almost 3 years. Had the pleasure with working with the trainees here over some virtual inpatient nurse publications, program analysis, alternate sites of care discovery, and capacity management innovations. Really enjoyed the time with them, and I'm sure you guys will learn a lot from them today as well.
Thanks, Julie. Josh, would you introduce yourself?
Of course. Hey, everybody. My name is Josh. I am currently a second year medical student, which is still crazy to say that I'm in the second year of doing this. Currently came straight through from undergrad. I did double major in business in undergrad, which is kind of where a lot of these interests first started. I kind of have a background as far as my major, and kind of the concentration that I did was in kind of systems level management and organization. So looking at a lot of systems and figuring out what are the best approaches to improving those systems. When I first got to WashU, I knew that this was the space that I wanted to be in, but didn't know exactly where to find said space. A lot of people are doing kind of a lot more hands-on basic science clinical research. And I was like, it's great, but that's not me. So really trying to find this space. And honestly, it happened by happenstance, and I'm very glad that it did. I was talking with Dr. Linda Wu, who is one of the innovation faculty members, and she really helps integrate the MD, MBA students, so people that want to go get their MBA at the business school as well. So happened to be just having a conversation with her. She said, I think you would be very, very great for this innovation lab. And she ended up putting me in contact with Ali, exchanged a few emails, had a quick little conversation. And next thing you know, I'm like working with Julie in the innovation lab. So honestly, very glad it happened. I didn't really set that up myself, but glad that I was making those connections to help me get here. And very excited to keep working and doing all the work that we've been doing with the virtual nursing program.
Wonderful. Well, excited to learn a little bit more throughout the course of this conversation. Gavin.
Hello, I'm Gavin. I'm a senior at WashU right now doing my undergrad. Like Josh, I double majored in business with my primary major being neuroscience biology and my second being healthcare management. I've always been really interested in data analysis and presenting those findings, so that really drew me to the Innovation Lab.
Thanks, Gavin. And Kendall.
Hello, everybody. My name is Kendall Jackson. I am currently a fourth year med school student, which, as Josh said, also having a hard time wrapping my head around that. I'm currently applying to pediatrics residency at the moment, and actually took a gap year between my third and fourth year of med school to complete an MBA. So we'll be graduating next spring with a dual MD MBA, and really excited about that. And broadly, my interest in the Innovation Lab and this work is really wanting to have a clinic or a career that combines clinical practice with systems work, and likely at healthcare administration. So really thinking about how do we expand access to care that is equitable, safe, affordable, et cetera. So excited to talk with you more today.
Wonderful. And last but certainly not least, Christina.
Hi, I'm Christina. I'm also a second year medical student like Josh. I guess unlike Josh, I took a few years off before medical school, spent some time in consulting, also spent some time in strategy and a telehealth startup. And that's kind of, I think, broadly where my interests lie moving forward, trying to figure out how can we do care delivery using digital interventions, and how can we kind of deliver care at lower cost, higher access, better, same clinical quality as we kind of, move towards the digital innovations. But yeah, I think excited to work with you all further. I think this past year has been really enjoyable working with Julie. I know we've been on many long calls, just kind of riffing off each other with ideas. So it's been a really great time, and I think really excited that I can continue doing this throughout the rest of med school.
Wonderful. Well, just like you heard from each of our trainees, they come with a breadth of knowledge as well as interest in various different areas. So while they were excited to work with us on our various different portfolio of work, we were equally excited because we have this wealth of resources and knowledge through the trainee program. So maybe to start, team, what I would ask of you is, and any of you sort of jump in here, but could you share with us how, and we heard a little bit from Josh in his intro, but just how you heard about the Innovation Lab in general, and then the associated trainee program and how you got connected.
I can start.
Yeah.
I actually heard of the program through, I think, someone who graduated WashU last year. Her name was Hannah Truong. We had spoken because she was doing an MD MBA, and I had, given my background in consulting and in startups, I was like interested just to understand more. And she, I think, did not end up working with Dr. Maddox in the Innovation Lab. She works with his wife. But I think through conversing with her, she was like, I actually think you might be a good match for my PI's husband. And that's kind of how I got connected with Dr. Maddox in the Innovation Lab.
Wonderful. And Josh, maybe you could share a little bit more about your conversations with Linda.
Yeah, so like I had mentioned, I knew that I wanted to do something in the space of innovation and the space of business, and didn't know what that looked like here at WashU. This is obviously my first time getting a degree here because I did my undergrad at a different place. I just didn't know what those fields looked like, or even I assumed they existed because WashU has everything, right? But like, where is that? And being able to talk to her, one about just, potentially obtaining an MBA from WashU's Olin Business School as well, but also like what research can I do here? Because those are my interests. And I didn't want to get confined and boxed into like all the research that everybody else is doing. That's great, like I mentioned, just not for me. And so I think a lot of those conversations were her just having full support, and then also her saying that she's had plenty of connections with the Innovation Lab, sending students there before who had really enjoyed it. So she was like, no pressure. I'll reach out. If it's something you end up wanting to go for, great. If not, no big feelings at all. And so that's when I I got contacted with you and had those interviews. I think later on, as I continue to have conversations with her, she actually plugged me in with Kendall, who I didn't know at the time, but had conversations with her about getting the MBA and like, what does that look like, fitting that into the medical school curriculum. So very much a pipeline that's happening here at the Innovation Lab. So was glad to have those connections.
Wonderful. I think it really probably stands to say that relationships and creating a network are so important as you not only think about your education, but then just pursuing your career aspirations. And so we are so happy to hear that you were able to leverage various different networks that you had outside of the Innovation Lab to even learn about us to start with. But then once you also were connected with the Innovation Lab, how you even leveraged those networks further to connect with one another and to connect with other people. So again, just while we think about there may be some very clear-cut pathways, that is certainly not the case. I think we find that it is really word of mouth and the networks that we're all a part of that allow us to bring in really great talent like you all. So thank you for being interested in us and then engaging with us further. As you think about then, once you were connected with the Innovation Lab, what was most appealing to you once you found out about it, and once you found out about the work that we're doing, that led you to say, yes, this is the right fit for me, or I want to learn more and I want to get further connected? And Kendall, maybe since you and Josh weren't able to talk in the first question, I'll start with the two of you.
Absolutely. I think one of the things that really struck me, I think it resonates with what you just said, Allie, which was about the sort of connection. And this goes back a little bit also to what Christina was saying earlier, is just the space to have the opportunity to get to explore interests. Like many of the other individuals on this call, I don't have a formal, actually, before my MBA, I don't have a formal background in business training. However, had a health policy minor in college. Like Christina, also had done consulting before. And so wanted to have an opportunity to get to both explore about things that I, was trying to apply my sort of business interest to the healthcare space and really figure out what do clinical projects look like in a space like the Innovation Lab at WashU. And so really, I think the exploration opportunities that the Innovation Lab afforded, as well as the community, and again, that networking component. And like Christina was saying, just that sort of riffing and the ideation that comes from really getting to see how a variety of people who come to the Innovation Lab think about problems from very different angles and how we all drive that forward to sort of come up with solutions. And so I think really those two pieces. Then I think the other cool part, and sort of relates to also what Josh was saying earlier, is the sort of evolving your career interests through the Innovation Lab too, and sort of knowing that there's specific goals that you want to achieve and attain through the Innovation Lab, but then how that sort of pivoted over time. And I know we'll get to probably this question, Allie, in terms of our specific research projects, but I think one of the things I really appreciated was that initial meeting when expressing interest in the Innovation Lab, to really get a sense of, what are my interests and how does the Innovation Lab, how can they support that, but also what are the projects and sort of how do my interests align, or where do I want to kind of learn something more. And I think that was both really great in the two projects that I've been involved with the Innovation Lab, is sort of that meeting of the two, that both interests, and how, again, can serve the Innovations Lab's interests, but also individual trainee goals too.
Thanks, Kendall. And Gavin?
Yeah, to kind of piggyback off that, I kind of felt the same way. I had dabbled in some wet lab research and I just didn't like it. And so I was looking at a different field to look at. And whenever I had a class with Linda Wu, amazing professor, and she told me about that innovation lab and then connected me with the innovation lab. And I realized that it really aligned with my ambitions of looking at, after all the science is developed, how do we apply it into medicine? And so that's where I came in, and I really liked it, and I really have loved all the work that I've done with this lab.
Josh?
Yeah, I think I agree with both what Gavin and Kendall said. I think something that stood out with what Kendall said is, I think the idea of really being able to explore what those interests are. I think I walked into the meeting with Allie like thinking, okay, she'll kind of just give me the brief rundown of what we're doing. Here are the projects you can get involved in, and like choose one, right? Like I think that's like normally the general process. And the meeting was very much like, hey, first of all, let's just start by getting to know each other. Like, I've never met you. Like, so I think we chatted for like 20 minutes about just Nashville, a bunch of things. And then after that, it was like, okay, so what are your interests now? What are your potential career goals? And like, how can the innovation lab really support you to get there, versus it kind of being like the reciprocal of that, where it's like, hey, you're coming in, choose a project and do it. I feel like that's generally how most labs go, not to hate on other labs, but that's just like the general process, right? And this is very much like, we want to make sure you feel supported in this. And so therefore it's like, let's align with what we're doing with what you want to do specifically. So like, if that's joining a project, great. If that's starting your own project, also great. Like we're open to both things. And so I think I appreciated having that foundation early on, which was really, really important when I was choosing kind of where I wanted to put my time. The other thing was, I think innovation is like a big word, big buzzword right now. Like everybody throws around the word innovation, but like, does anybody really know what an innovation actually means? Like, is there like a real definition of it? And I think when Allie was presenting some of the projects, you could just see like the vast variety of different projects that were being presented. Like, I don't have a software engineering background. I don't know how to code, but at the same time, we also have a lot of throughput projects, or like looking at big system-wide projects that I could get involved in. I'm like, oh, that's my thing. Let me hop in there, right? So I think I think I just appreciated the flexibility. I think kind of just the overall personalization for what my goals were that really ended up drawing me in the most.
Yeah. Christina?
Yeah, I think I definitely reciprocate, like echo what Josh and Kendall said. I think one of the things that really drew me was kind of how the Innovation Lab felt in many ways similar to the startup environment that I had spent some of my gap years. So, very agile, a lot of projects, like not afraid to fail fast, but also not afraid to like pilot soon and like kind of get data from like real world experience. And I think that is something that like really resonates with me in terms of like figuring out where to go next, or like will this work for where we are. And so I think that kind of environment lends itself to the exploration, lends itself to being creative and flexible, and also I think gives us the opportunity to like be very involved because the teams are small, and like really get our hands dirty. And I think ways that typically when you join other labs, you're kind of relegated to very clear cut defined roles and duties, whereas here I think there's a lot of breadth and room for us to just like be as involved as we want to.
Yeah. Appreciate you all so much for saying the kind words. We're pretty proud of ourselves as well. So, note to anybody listening, if that's of interest to you in terms of how we operate, it's very collaborative, and we're excited to not only grow the Innovation Lab, but also to grow you as professionals in this healthcare space. Keep us in mind. I very much appreciate all of the kudos, but really the brunt of the work in managing this program is managed by Julie. And so you all had an opportunity to work with Julie as you started to get more involved in the actual project work. And so I think our readers would appreciate that, just, what projects specifically you were working on and how those projects have helped you even further pursue the goals that you just mentioned. Kendall, I'll put you on the
Yeah,
spot.
no, I was gonna say I can kick us off. I feel like it's hard with virtual in terms of who's gonna unmute first. But it really, I will say, it has been really such a joy and a pleasure to get to work with Julie and to learn from Julie. She is such a wealth of knowledge, and also just to echo what you were saying, Allie, I think is so developmental, like so focused on the development of all of her trainees, and I think that's been really incredible in terms of the step up opportunities that she's provided, the stretch opportunities, and also the coaching has been really great and really wonderful. And I think in that regard, it's been really wonderful to see skills that I didn't know I needed to develop, but with Julie's sort of coaching and guidance, have been able to continue to grow in that perspective as well, which has been really wonderful. And I think, Allie, you also wanted us to talk a little bit about our projects. Is that correct?
Yeah.
So I've been involved. I had sort of two stints with the Innovation Lab, one before my MBA and then one after returning from my MBA. But my first stint with the Innovation Lab was back in 2021, and it was part of a sleep studies essentially project that was with Kayla Painter and Dr. Maddox and Dr. Pat Lyons and a number of other med school students. And we were essentially studying sleep in the hospital with the recognition that sleep is foundational to health and pretty fundamental. But however, I think if any of us have spent time in hospitals, you know that hospitals are not the most restful environment. So really coming up with number one, like interventions that were rooted in the lived experiences of patients, nurses, and physicians, and then getting to ideate and test those interventions to ultimately create a much more restful sleep environment. And that paper actually recently was just published in JAMA Open, which was really exciting. And then the project that I've been most recently involved with Julie, starting this year, is on patient progression and throughput at two of our community hospitals in St. Charles County. And it's been a really wonderful opportunity, again, to sort of get to develop skills that I knew I wanted to build, but really getting to see them take off in ways that I could never have imagined, to really gain exposure to how different hospitals get to operate and how they work, getting a better understanding of all the stakeholders that are involved, and then also really think about, again, sort of the foundational model of the Innovation Lab, of that discovery and design and the double diamond, and really thinking through all of those pieces and how it fits together to come up with solutions that really bring together all stakeholders to ultimately improve patient care.
Great. Thanks, Kendall, for your two-term involvement with the lab.
Thank you for having me back.
Anyone else want to share their projects that they've been working on?
Allie, I think we would be amiss if we didn't call out Gavin and his analysis work, and also Christina for her split role between the publication and the discovery work around alternate sites of care. I think, everybody included on this team just brings such a wealth of knowledge and a diverse background that I really want to highlight all of the roles that you could hold while you're a trainee in the lab. So Gavin, I'm so sorry to put you on the spot, but you can't let us miss out on learning about all the awesome work that you've done.
No, it's okay. I was just about to talk to it before you hopped on right before me. But yeah, I really enjoyed I've really focused on this VRM project, and on the start of it, I remember going with Julie and doing observational clinical studies, and I had never done those before. And it was just hit the ground running, and she really helped me walk through how to do everything with that. And it was really helpful to learn how all that process worked. And then after that, I've been able to really delve into doing data analytics and being able to apply a lot of stuff that I've learned in school, where most of the stuff I've learned throughout my undergrad, I'm never going to use this again in my life. And then here I am using it again in my life. And so it's been really nice to look at this project and go, oh, I can do that because I've learned it before, and being able to apply things I've learned and use them in real life situations, and also being able to learn from other people, from Josh and Christina, on how to do presentations and how to work and create these papers. And it's been a really valuable experience as we work on this VRM project.
Thanks, Gavin. Yeah, I think that's a great example of the breadth of involvement that you can get involved in. And I know we've talked a lot about aligning the portfolio with your own personal goals, but regardless if that's, wanting to understand from how we conduct user research to identifying a problem, to finding a solution, to evaluating said solution in the environment, I think there's a lot of entry points of how you can get involved. And I know one of the areas, Christina, that you've been involved in, like Julie said, is doing a lot of that discovery work around alternate sites of care. So can you share some of your insights there?
Yeah, happy to. So with the alternate sites of care project, I guess just a little bit of background. I think because I did spend some time on strategy work and kind of like service line launches during my gap years, I was really excited to like keep doing some of that strategic, more like, I guess, like upstream work, perhaps you could describe it as. And so after like talking to Dr. Maddox, he had mentioned how, especially given I'm interested in like telehealth and, digital innovations, like the alternate sites of care work stream might be a good fit for me with Dr. Kirby and Julie. And so I think I've really enjoyed sort of doing the due diligence there, kind of understanding, what are other hospital institutions doing that you could classify as alternate sites of care, trying to understand, what are things that perhaps we at WashU and BJC could borrow and, bring on in-house, or what are things that we're already doing, but perhaps not at the scale or in the same way as other institutions that we could learn from. So I think that's been really exciting, just thinking through like strategically what makes sense for us, but also like practically in terms of like our patient base and, the kind of demographic that we serve, what is the most, realistic for what their needs as well.
So I know several of you have articulated the projects you're working on. You've talked to us about how you became interested and, aligning those interests with things that you were already thinking about. But as you reflect back on the time that you've worked with us, and you could say definitively, gosh, here's the success that I saw of my involvement with the lab and aligning back to my original intent of why I wanted to get involved with the Innovation Lab. Could you share maybe how that's come together for you? Like, what's been the success of your involvement with the Innovation Lab as you think back to those goals that you had? And Kendall, I know you talked to us a little bit about upskilling in some areas, and so maybe I'll start with you. Just could you share a few insights on how you feel like you've achieved some of those personal goals?
Absolutely. I think definitely the upskilling component, as you just mentioned, Allie. I think the other thing I would certainly highlight is, I think, again, going back early in our conversation, which is I think, purpose of, or my goal of exploration and really getting a better understanding of, I have this long-term goal and working with healthcare systems. And really up until this point, before the Innovation Lab, like truly knew the hospital system that we have the privilege of working with as WashU med school students, but getting to sort of expand that right now with the project that I'm currently working on with Juliet in St. Charles County, and really understanding how different hospitals deliver care, what they're sort of working with, et cetera. And I think that exploration has just also really opened my eyes into further interest down the line. And I think as we also sort of think about, or as I've been thinking about my work with the Innovation Lab, it also is trying to think about like what are my long-term professional goals and how does my work with the Innovation Lab also sort of dovetail into that. And I got to tell Julie earlier this year that I was like, the project that I've had the privilege on working on with her really is one of the first times where I felt like the research is related to what I see myself doing in the long term. And so it really is that great opportunity to really sort of, again, find that match. And as Josh said, there's kind of always a like, sort of a test process as we also figure out our interests and figure out, what space of research makes the most sense and what lab and what project and all of these pieces, but really getting to see it come together. And the project that I'm currently working on has been, I think, a really fulfilling moment for me as I think about my future career and my future goals.
Absolutely. And maybe Josh, could you share a little bit about how it's come together for you?
Yeah, I feel like Kendall and I have very, very similar goals and interests, which is great. We'll need to reconnect soon. I think for me, a lot of my work was also with the virtual nursing program. Specifically, I feel like it was a lot more data gathering, trying to like put together some trends, ideate with Julie, like, okay, we see said trend. Why could this have happened? Like, can we get to a root cause why this is? Like, why are we seeing what we're seeing? So many calls with her on that. I think that is probably the biggest thing as far as interest for me, being very interested in the systems management and even getting into like some healthcare management, looking at systems and figuring out like what are the weak points and why are they happening? Can we get to a root cause of why we're seeing this potentially systemic failure? And can we then leverage innovation to fix that? And so a lot of those conversations were just us two bouncing ideas off of each other, using Julie's expertise because she's been conducting a lot of these interviews. She's been doing the time study analyses, so she's been there. And then me being able to potentially add in, well, granted, I've only been here a year and a half, my medical knowledge, if we can say that, along with kind of the business mindset so that we can really tag team and bounce ideas off of each other. And so I think long term with those goals, like Kendall has been saying, really being able to kind of leverage medicine and business together to really affect systems. And so I've really seen that play out throughout this process, and also have learned a lot about the hospital that they don't teach you in school either, which has been great because that matters just as much. You're going to be working within these systems and not really understanding the business aspect of that doesn't help you really change the entire system. So having kind of that mindset and being able to talk to Julie about that has been very, very helpful.
Great. Well, as we close up our time here, I would ask maybe each of you to give a bit of advice for anybody who is interested in working with the Innovation Lab, maybe wants to learn a little bit more. What advice would you give them if they're listening, watching today's session about how to get involved and maybe, just what it's really going to do for them if they consider the Innovation Lab trainee program? And I'll start with Christina.
Yeah, I think for me, perhaps like the biggest piece of advice I would give, and I think a lot of us on the call today mentioned having like some sort of exposure or background in like business or management or economics, like adjacent to what the Innovation Lab is doing. But I also think the beauty of the Innovation Lab is that you don't have to have that background to come in and still have value to your team and be able to kind of get your hands dirty with the work. I think again, because there's so many different projects that are happening and they're in such different aspects of like, let's say like the life cycle of a project with the Innovation Lab, that there's a lot of opportunity to kind of learn those skills on the fly. And I think that's actually what I also find great of like non-wet lab research, kind of like Gavin was mentioning there. You don't have to like understand all the protocols and you don't have to know, I don't know, like how to do all these different procedures within the lab. You can just kind of come in and learn on the fly and you'll still be a valuable asset to your team. And I think that's one of the great things. And perhaps like one of the things I would tell people who are interested, but perhaps don't have a background and want to get involved.
Yeah, great. Well, Gavin, she called you out in your experience with your previous wet lab and then now working with the Innovation Lab. What insights or advice might you give to someone?
I think definitely piggyback off of what Christina said, coming in and like knowing just something, and it's like whatever you used to know, you can always build on it. And for me, a lot of it's been like, oh, I mostly know how to do this, and like I can like do some extra research and figure out the rest of the way to get it done. And to me, that's really allowed me to like grow like my skill set and feel more confident going into things because you can always like bounce your ideas off of other people to make sure that you're doing it correctly, even if you aren't sure at first. And I think it's been really helpful and has really allowed me to like grow. And I think anyone coming into this lab, it's just like a great way to grow your skill set, whereas like a wet lab or some other kind of lab might not allow you to do that. And that there's so many things and different things that you could do that no matter your background, you'll find somewhere to fit in.
And Josh?
Yeah, first, I would be remiss to say if I didn't give Julie a shout out. I didn't have time to do that earlier. So shout out to Julie for all the work she's been helping us do. The amount of time she sent an email, she's like, hey, happy to schedule some time if you need to like chit chat or anything, or like answering emails on a Friday at 10 p.m. Like really going out of her way to work around our very busy schedules because we all have very chaotic pre-med and med student schedules. So very much appreciate that. As far as thinking about advice, one, I feel like I tell all my little mentees that I have, like really, really following your interests. I think that not everybody here at WashU in our classes is going to be interested in innovation, and that's okay. And so like it's a very small cohort of us but we normally are pretty dedicated to this work. And so oftentimes you'll like have friends or know other students that are doing a lot of great work in other labs, and maybe it's like, well, this is like the innovation lab. It's just a little different. especially what's being valued within like residency programs and things, but like following your interests and following things that you're actually interested in. I'm a big proponent of that. So even if you're like, I don't know if this is going to work out and I need this, and that for my residency applications, like still exploring the interest of the innovation lab. And I think it will all work out. One, you'll be able to talk about the innovation lab within the interviews and they'll like see how dedicated you are. But also, hey, we're out here pumping out papers. Kendall just had her publication, right? So like I think there's a lot of room for opportunity for anything that you're interested in. And I think going back to kind of what we talked about earlier is really the support that exists here to get you to where you need to go. So like if you come in and you're like, hey, Allie and Julie, I really need to pump out a paper. Not that I'm like super concerned about the publication, but my residency program is like, is this something that we can work toward? And really, I think leveraging that and leveraging kind of the flexibility that we have here in the innovation lab.
Thanks, Josh. And Josh referenced our newly published author here, Kendall. So Kendall, I'll give you final words on advice that you would give to anybody interested.
Absolutely. And before I do that, Allie, I'd also want to shout out the other med school students who aren't on this call because they have all moved on for the most part in their training. But Kayla Catley, Ashley Huggins, Jenny G, and Anusha Senka all really instrumental to that paper. So I'm one of many authors on that paper. So just to shout them out, in addition to, as I mentioned earlier, a number of other clinical support and Kayla Painter too. So I think in terms of my advice for people interested in the training program and the innovation lab, I think it really comes back to, I think number one, recognizing that there are a breadth of opportunities that exist within the innovation lab. And again, that I think one of the things that the trainee program does it particularly well is really trying to figure out what your interests are and how they might align with the program, both in terms of your interest in whether it's pediatrics or adult medicine or cardiology, et cetera, or also the type of work that you're doing and the type of research. And then as Christina mentioned too, the phase of the project as well. So I think there's a lot of different variables. I think the thing I would say is spend some time on the Innovation Lab's website. There is a number of projects that are showcased, and it really does, I think, really encompass the wide breadth of projects that exist. And then I think the second piece I just say is don't be afraid to reach out and initiate that conversation and express your interests and figure out where they might align with the Innovation Lab as well.
Thanks, Kendall. And thank you all for taking the time to talk with us today about the Healthcare Innovation Labs trainee program. And thank you all for listening and watching today's session. As you heard some of us mention, check out our website. That's healthcareinnovationlab.org, where you can find out more about not only the trainee program, the projects that we have either tested, validated, and sometimes implemented throughout the organization. But you also heard we fail fast. And we try to learn those insights quickly, so you can learn about those as well. To connect with any of us individually, you can find our contact information on our website, and we look forward to hearing from you soon. Thanks.